Okay, well, greetings and welcome to all of you. My name is Mike Studer, and I want to introduce today's course and introduce my fellow speaker and invite all of you for your interactive participation today. You are ready for dual task gamification, where we're going to be delivering optimized brain and body health. Just a little bit about me as a background. Again, my name is Mike Studer. I'm a physical therapist and have been for 32 years, clinician, author, academician, researcher, and just really dual task and enthusiast. And I also want to introduce my colleague, Dr. Robert Winningham, and I'll turn the mic over to him now. You're on mute, Rob.
Thank you, Mike. It's a pleasure being here with all of you today, talking about dual tasking. I'm a professor of psychology and gerontology at Western Oregon University. I've been a researcher in the space of cognitive gerontology, looking at older adults and their brain health. Mike and I have had a pleasure to work together for over 20 years. I remember it was almost 20 years ago that I started seeing Mike talk about dual tasking. We were doing brain health classes in his clinic, and we would mix that into our cognitive stimulation program. And it's evolved a lot since then, and the research has evolved a lot since then. So it's going to be fun to share some updates on that with you today, and also see how SMARTfit can utilize the latest science on dual tasking. But I think it's important to talk about what dual tasking is. I think there's a lot of misconceptions about dual tasking and multitasking. Dual tasking is generally doing both a motor and a cognitive task simultaneously, whereas multitasking is generally attempting to engage in two cognitive tasks at the same time, which I'll tell you really isn't possible. You know, you can pay attention to one thing or the other. You can't pay attention to both. And the research on multitasking is interesting. It shows significant deficits in performance when people try to do two things at once. Because what happens is really they're task switching. They're switching between one cognitive task and the other. And there's a decent body of research on that. It does show that people can improve their multitasking. They can have quicker reaction times. They can decrease the number of errors, but still there is a decrement in performance. So multitasking is bad, I always tell people, and I don't think it's something people should actually be incredibly proud of, because people could argue with me about this, but if people are consistently multitasking, it shows a lack of discipline. In my opinion, you really want to focus on one thing, get it done, do it well, and then focus on another thing. I understand in some situations you have to do that, but it's going to come at a cost. And you start looking at dual tasking, it's everywhere in the world. You know, we're walking and participating in a conversation, or knitting while chatting. You know, in these examples, the walking is the physical, and then the talking, the conversation, the chatting, that's the cognitive, obviously. And so you can think of a lot of examples of this. And then, you know, the complexity of the task is going to matter. The challenge of particularly the cognitive task is going to matter. Other psychological variables, fear that comes in will matter. I think that's something that Mike might talk about just a little bit later. So dual tasking is everywhere. We can simulate it in the clinic, and then people are much safer in the real world. Now, the benefits of dual tasking are many. You know, just this morning, you know, Mike sent me an article he saw. It was actually a meta-analysis where they combined studies. They combined a number of studies together that met the criteria, and just another study found dual tasking in this case help people with Parkinson's disease more than if they did their standard care. And that was in terms of their gait and their gait speed. But in that meta-analysis, they also confirmed significant improvements in executive functioning. And that's what we see when we measure the cognitive side. Dual tasking can also improve the single task performance on the physical. And that's kind of what we saw in that Parkinson's study that just came out, was they got better at the physical only, the gait speed, right? But dual tasking can also improve the cognitive side. And actually, other research has shown that dual tasking can improve cognitive side, mostly the executive functioning, more than your typical cognitive stimulation program. Now, it all matters kind of what you put into this and the intensity and the dose, but that is really interesting to note. This could even be better. And dual tasking may also improve tolerance and our ability to prioritize tasks. We often, when we're in a dual tasking situation or even a multitasking situation, we need to be aware that this is happening and we need to prioritize which ones we want to do. And when I think about older adults and walking and dual tasking, a lot of that prioritization should be related to their own safety and an increased awareness of their safety in a dual task environment is absolutely critical. So I do want to just talk a little bit about executive functioning, because if you get into this literature on the cognitive side, as I mentioned, that is where we see improvements. And executive functioning, it's largely in the frontal lobe, the prefrontal cortices. It includes attention and all the different types of attention: sustained attention, selective attention, divided attention. It also has cognitive inhibition. And it's interesting, in this literature, you sometimes will see improvements in mood, because if you can improve executive functioning and people are better able to inhibit, they can often inhibit kind of sad thoughts, depressing thoughts. So that's a finding that often pops up because of inhibition. But there's also another type of inhibition. One is controlling our thoughts. The other is controlling our behavior. This is not a good time to be doing this. I need to not do this. I need to inhibit that behavior. Problem solving, reasoning, planning, and then working memory. What we're holding on in our minds at any given moment is kind of all a part of executive functioning. And the important part about this, if we can improve executive functioning, then that is likely to generalize or transfer to things that have never been trained. And you kind of get into this space a little bit, particularly on the cognitive side, and you say, well, what good does these brain exercise do? Do they just help you get better at the game? Well, the answer is no. If we improve executive functioning generally, then that transfers to real world settings. And so I'll go through this short. We could talk for hours about this. Literally thousands of studies in this space showing the effects of physical exercise on executive functioning, but the effects are really significant. First, we found aerobic training helps executive functioning. Then we found strength training, resistance training, and that's actually turns out to be really powerful effect for people that have mild cognitive impairment. Even once or twice a week resistance training has been shown to improve people who have mild cognitive impairment, kind of in the same level of effect that we'd expect from a pharmaceutical like Aricept. Yoga has been shown to improve executive functioning, as has Tai Chi, as has HIIT training. But dual tasking has some of the greatest promise for the largest effects. And, there's a lot of research in this space. We're to the point now we're doing meta-analyses, combining dozens of studies into one study. But in general, we're finding that dual tasking improves cognition greater than no intervention. Dual tasking improved cognition better than exercise alone, as we were just discussing in the previous slide. Dual tasking improves cognition more in older adults. And this is something we see in the literature. We see a lot of these interventions, be it cognitive stimulation, physical exercise, the effects are larger in older adults. And we could, debate why that is, but a simple answer is they actually might have more room to improve. If a middle-aged adult's functioning at a pretty high level, it might be hard to measure an improvement. But if there is a little bit of impairment, then we can measure a larger improvement. Dual tasking effects also appear to last longer than single task effects. That's another thing that we need to think about when we get into this, into these ideas in this literature. Yeah, this effect can last for 8 weeks, 12 weeks, the length of a study, right? But we want to know that these effects will last beyond that. Ideally, people will continue to engage that, but as we know, many people will stop doing that, particularly if their therapy is done. So it's important that these effects last for a while. So we see these effects. We can measure them with executive functioning. We can measure them with the physical activity, the gait speed, other measures of physical activity. But the effects are so robust, we can actually see them in the brain, quite literally. So after a 12-week program of dual tasking, we see improvements in executive functioning, but we look at those same participants and we look at their prefrontal cortices and we see improvements in that functioning, more efficient functioning. So we're seeing it actually is changing the brain. And it is important to look at how large the effects are. You know, as many of you know, you can actually get a statistically significant effect if you have a large enough subject, even though that effect might not matter in the real world. So a lot of times we will look at how large the effect is when a field like this is maturing. We want to know, is this meaningful? How worth it is this training? And the good news is the cognitive ability improvements in these studies were moderate improvements. The ability to do activities of daily living were large improvements. That's huge because the activities of daily living, the ability to do those determines independence. If you can do your ADLs, then you might be able to live in your home. If you can't do your ADLs, you're going to need to bring in help or go to an assisted living community. So in terms of quality of life, that's huge. And there's one of those mood effects. And that might be through better executive functioning and better inhibition. So I'm going to hand this over to Mike now, talk a little more about dual task and kind of take in from the perspective that he has by doing this in the clinic with his patients.
Perfect. Well, thank you, Dr. Winningham. Always a pleasure to speak with and learn from you. Every time I learn something new. We're ready to transition into this consideration that a stimulus of dual task is very critical as we age so that we don't lose the capacity to dual task. And that is relevant in several different layers, some of which Dr. Winningham already talked about and I'll elaborate on. Let's consider that the individual that has been exposed to dual task stimulation throughout their life and continually is going to be that much more capable of tolerating distractions. So let's look at the lose it side of things a little bit first. What happens with a natural course of aging were you to not engage in stimulation? You should, as you look at the bullet point down on the left, become less tolerant to distractions. And many of you are already experiencing this. You know that if you are an empty nester, and you are used to having a very full household of children, that when you have less stimulus, less noise, less distraction, you become less tolerant of those very things that you used to be regularly exposed to. So it's natural that we would become less tolerant of distractions. Then when that happens, we may or may not recognize that we are less tolerant and become, by choice, less participative. When we're less participative, that means we choose not to go to the birthday party, choose not to go to the busy grocery store, and we may become less active as a function of that. As you see the vicious cycle continue, there may be a greater fear in engaging in environments that involve distractions that would next ensue. And then finally, a higher fall risk when an individual is compelled to go to that wedding reception dinner and they have not been out amongst people tolerating distractions, small children, pets, or larger ambulatory, crowds, pedestrians around them. When they have become less tolerant all the way through the vicious cycle, they are now at an elevated fall risk when they're introduced to what is now a novel environment compared to what they have traditionally experienced. So we're ready to then consider a combination of dual tasking and a quite engaging principle of behavioral economics known as gamification. And contrary to the figure that you have here, we're not going to be talking about Clue or Candyland or Monopoly, etc. Let's delve into gamification and understand it a little bit better over the course of the next few slides. When we gamify, we give people the opportunity to be able to engage more deeply, depending on the type of personality that they bring to the relationship. Let's keep in mind that not everyone is a competitive individual, nor do we need them to be competitive by nature to benefit from gamification. So we may have gamification against other people in a large crowd, actually a well-sized room within an assisted living facility that's participating in a group activity. Who can be the first one to come up with this answer, come up to the board, answer this, who can actually complete this activity sooner, who can get the highest score in. So there's gamification that really is shaped in those types of features. Additionally, if you're a little bit more inhibited in competing with others in a group, you can also compete against your own high scores. Some of the videos that we're going to demonstrate today give that singular opportunity to be able to participate, and therefore, you see as the next box here, you may engage in a more higher intensity or a richer experience so that the repetitions, the minutes, and the time that you spend in a group exercise activity in a therapy environment can have a greater degree of intensity, which we all know based on literature will have a greater effect on neuroplasticity as well as the mitigation of degenerative diseases. Now, consistent with what Dr. Winningham has talked about, certainly dual tasking will be a stimulant for greater attention. And let's keep in mind that gamification just redoubles that effect so that an individual is concentrating so that they are trying to get their best score across a group or their best score across their own individual performance. Let's also be mindful that there's a bidirectional accountability that occurs within the gamification principle here, wherein the therapist is held accountable that their interventions are actually creating a measurable and objective difference for the individual, and the individual's participation, consistency, home exercise programming, group exercise, frequency of attendance, they're also held accountable so that the improvements that they make are likely tied to the degree of frequency and degree of intensity in which they have participated. So there's some bidirectional accountability that happens there. And the nice thing is that, as we'll share with you today, when we are using an unbiased third-party arbitrator, such as a SMARTfit tool, to be able to report your scores, it's not the therapist's opinion. That is actually that much more trustworthy for the patient to be able to look at the score and know that the score is truly a representation of their performance rather than a subjective opinion of a therapist that might be pandering toward them potentially. As you move toward the bottom of the slide, you'll see that there is a rich amount of literature that's really helping us to understand the benefits of play. And the benefits of play can be reducing the cortisol effect, increasing the dopaminergic effect, and be very relaxing overall for an individual to not really be thinking about their recovery from stroke, their control of Parkinson's disease, their control of mild cognitive impairment, but to actually just engage with a degree of enrichment that harkens back to play, which is really just scratching the surface of what we know about this area of literature. And then finally, potentially, depending on the delivery of your dual tasking, as you all know, we may have the benefits of socialization with the group programming, whether that be all done at the same time or even consider some singular programming, and there may be a high score posted within an assisted living facility, and then we still get the gamification of people talking about trying to compete against one another, whether they're doing so concurrently or not. So you may or may not appreciate this slide, but to me, combining dual task and gamification is truly the chocolate and peanut butter. I prefer dark chocolate on that though as well. So let's look at what happens when we combine dual tasking and gamification. We can benefit from the higher intensity principles that we've spoken about and appreciate the physical exertion. Dr. Winningham's already done an exceptional job talking to us singularly about the benefits of physical exertion and exercise, if you will, on the brain. Let's additionally appreciate that there's a large body of research that talks just about the beneficial effects of receiving a variety of cognitive stimulation as we age or with disease to manage a rehabilitative program, etc., so that we can keep individuals stimulated. Remember, again, with the use it or lose it principle, we also understand that there's use-dependent neuroplasticity so that we can expect with physical and cognitive stimulation to receive benefits therein. Additionally, with the gamification added on, we understand that there is that engagement. And we all talk about therapeutic alliance and intensity and behavior change. And really, one of the main things that we're looking at here is to be able to more deeply engage the clients with their intensity so that our dosage makes a greater difference. So really, what more could we ask for when we've got these things combined? Well, let's keep in mind that there is that concept of personalization. And you might have to ask yourself, well, how can we utilize a program and still personalize it to the individual? And personalization can have a couple of different layers. We can be thinking about personalization in terms of the types of activities, cognitive stimulation that someone might like to participate in. So it's helpful that your dual task programming has a variety so that you can personalize within this individual's preferences. I don't like mathematics. Oh, don't ask me to spell a word backwards. I don't like trivia. I don't like to actually interact with, things that make me feel stressed. So we want to keep things personalized in that layer, but we also want to think about personalization in terms of the true level of difficulty for the individual. And that's why I'm very proud of the work that Dr. Winningham and I have done to be able to advise and do some R&D with SMARTfit so that we can truly offer individualized levels of difficulty on the physical side of things and on the cognitive side of things in incorporation with our dual task programming folder. So at this point, I'd like to share with you just a little bit of a vision about what this might look like. I'll talk you through this, and we've left the audio off on the slides intentionally. Let's just do a timed up and go shuttle. So here again, you'll see the individual coming up, tapping the screen. No decision making needs to be carried out here. And we'll be able to calculate the number of laps that she can perform here within the 30-second shuttle experience here. And you'll see each time she touches the board, she's added another point value to the opportunity. And so we're keeping track of her performance, and you'll see it finish up here as we expire at 30 seconds. So that's recorded, and we see that as the physical only. Sometimes we'll abbreviate that as PO, and when we get to the dual task cost equation, you'll see that as the single task physical, okay, or single task. Now, let's go to the next slide here. And now you're going to watch the same individual. Actually, this is a different individual, but in order, they would have been doing this next. Now we're going to participate in the cognitive only. So you'll see this is totally different, where the individual is now interacting with the board, and they're going to be tapping every other letter of the alphabet. Again, this is going to be consistent with what Dr. Winningham talked about earlier, some response inhibition. You normally would want to go to A, B, C, D, E. So you're inhibiting that temptation response, and you're causing yourself to skip a letter as you go. Again, so that we've got some methodology here, you'll see that this is a 30-second experience. And we're also keeping some gamification in play here. You'll see her score goes up with each time she correctly taps the board. So let's say we've calculated that as well as a single task, cognitive only. All right. Now, let's combine the two. Here comes peanut butter and chocolate together. And let's see what happens if this individual does the cognitive operation with the timed up and go shuttle. Again, 30-second experience. You'll see the countdown. Now she has to be thinking to herself, what letter do I look for next? And you'll notice that the letters are randomized each time. She's found an E, we skip an F, we're gonna go find the G. You're looking for it now, she's decision making, it's there. Right now she's thinking, skip the H, look for the I. Boom, she knows where it is. And so she's truly dual tasking here now. And she's, as you saw there, really propelling herself to get there before the time would expire, which isn't necessarily available if we don't have this feature of gamification and the timer going on as we go. So now let's go into that natural next step. Let's consider how we're going to use this information so that we can clinically benefit from that experience and from what the machine can capture. And please understand, I've shown you just one very small drop in a very large bucket of what the SMARTfit can do for dual task gaming and also dual task measurement into cost. But here's what the cost looks like. And you saw that already. First step, let's measure the physical task in isolation with no cognitive operation. Second, let's measure the cognitive task in isolation. We'll call that single cognitive. Then let's combine the tasks, truly dual task, and now let's calculate dual task cost. The dual task cost equation can be expressed in this manner for this operation, where we have a single physical and we subtract away the dual task, and then we divide that by the single physical. Now, when we multiply that by 100, we actually come up with the dual task cost. And there's any number of ways of doing this. And fortunately, SMARTfit's capturing all of them at the same time. So let's say the individual performed 6 laps in the 30-second experience, and she performed only 5 laps in the dual task experience. So we would have 6 minus 5, and then divide that by 6. So 1 divided by 6 there, multiplied by 100 would be her dual task cost. Obviously, you'd be looking at something in the neighborhood of, let's call that 17%. It's somewhere in that nature. Now, the individual, if we saw in the video, had 6 repetitions in the shuttle for physical single task and 6 in dual task, then that's good information also. We want to know that this individual doesn't need more programming in this attribute of dual task cost, where she is dual tasking on top of her gait. We've got many other features to look at. It would be quite common for an individual with Parkinson's disease, an individual with multiple sclerosis, those with concussion, those recovering from stroke, and on, to express a significant difference between this. And ultimately, we only want to create programming for the individuals that truly, out of a screen, prove that they need more programming or further testing in this manner. So it can help in that manner as well. Let's look at steps 5 and 6. Then we would want to be able to communicate the results, which the SMARTfit does beautifully in the tablet. We can look at the physical task cost. We can look at the cognitive task cost in many of the games and principles that we utilize. The timed up and go shuttle doesn't lend itself beautifully to a cognitive cost, and you can think about that or ask us questions about that in the upcoming section, where we're going to be doing some Q&A with you. But many of the other features that we do, and we'll talk, should you prefer to elaborate more, for us to elaborate more on the other features within the folder, we can do that as well. But back to point, we'll communicate those results in a nice graph that expresses the percentage of cost, physical, cognitive, across the dual task. And we can do that in accuracy, in response time, and in overall scoring. Then finally, we can leverage that cost that's been educated and communicated in a gamification opportunity, giving the individual either another immediate opportunity to perform the same, where we risk some practice effect, or at a later time, after we have been able to create a plan of care, issue some home exercise programming that's informed based on the testing that we've done, or potentially even with some intervention that is offered clinically, we can test them again later in the session, in a couple of sessions from now, so that we again have that accountability opportunity with the gamification. So let's understand now the benefits of measuring dual task costs, so that you can clinically apply these in your skilled physical therapy, occupational or speech therapy setting, multidisciplinary team, or even into assisted living facilities. Now, I don't want to read the bullet points to you for what you see on the screen, but I think you can certainly appreciate when an individual has had the opportunity to be measured in dual task, they can understand, wow, that was a pretty significant difference. That does help with a degree of awareness and helps to be able to back up some of those considerations that Dr. Winningham introduced to us with regard to prioritization. I'm at risk when I'm distracted, therefore I must devote my focus on my walking. Or potentially an elderly grandmother saying to her granddaughter, honey, I really want to hear about your day at school, but let's do that after I get over here to the chair so I can sit down and pay attention and listen to you. We've already talked about the gamification, the intensity, and the benefits on the cognitive attributes, but let's also keep in mind that the individual will have some of those opportunities to be able to divide and make those decisions with the real world prioritization on their own. We actually want to watch that happen clinically after we've had an opportunity to see what happens in the SMARTfit gamification application as well. And then finally, the literature is very strong in helping us understand that automaticity, that is, your single task performance is going to improve when you have constrained your attention and borrowed it elsewhere. I do want you to think about constraint-induced movement therapy, if you're familiar with that term, where we're tying up the attention, borrowing it over here, and compelling those centers of procedural memory, basal ganglia et al., to be able to perform that walking task, that standing task, that sit to stand, that balance task more robustly and reliably because you don't get to devote attention over to it. Let's also understand that this having improvements in these arenas will help with our safety, and that will ultimately indicate exactly what Dr. Winningham said, need for assisted living, but also the level of assistance within assisted living can be affected or mitigated by your improvements in this area. Let's not lose sight of the fact that you don't just benefit in a safety manner, can I perform this, but critically, what also may influence the amount of caregiving from your friends, family members, or paid caregivers, it may be influencing your efficiency in dressing. How long does it take you to meal prep, perform IADLs, light hygiene, but also your independence. So safety is one attribute that's often highlighted, but let's not forget about efficiency and independence, because if you aren't efficient, you may need caregiving just to hurry yourself along and get done with a task.